Today, we will talk about how to treat ADHD without medication in adults. Let's have a look at the details. Some doctors are hesitant to prescribe ADHD medications to adults, especially older adults, who have a greater risk of drug interactions. If you are having trouble with everyday functioning because of ADHD, then trying drug treatment makes sense. If the impact of ADHD is minor and you've figured out coping strategies without a formal diagnosis and treatment plan, your doctor may instead advise treatments that don't involve medications. Cognitive behavioral therapy, ADHD may have a particularly serious impact on a certain part of your life, such as job performance. A therapist can help you work on areas that need special attention, giving you strategies that can help in specific situations at work and elsewhere. One widely used approach is cognitive behavioral therapy, CBT. This type of psychotherapy helps people change negative thought patterns into positive, healthier ways of thinking. The idea is that if you change the way you think about a situation, your feelings and behaviors can change, too. For example, CBT may help change all or nothing thinking, in which many people with ADHD tend to think that their accomplishments must be either perfect or a failure. CBT is very focused on giving you tools to help deal with stresses and challenges in life. Working on self-esteem is often a very important aspect of ADHD treatment. Emotional therapy, ADHD is not just about paying attention in conversations and in meetings. ADHD can lead to frequent emotional ups and downs, which can hamper relationships and everyday activities. Just waiting in line can make a person with ADHD quite irritable. So can minor setbacks, such as having a project not turn out quite right or having a boss who changes deadlines or who demands more work at the last minute. It may help to find a psychiatrist or another type of therapist and meet regularly to discuss your symptoms and any challenges or successes in your life. It's also common for adults with ADHD to have other mental health conditions. An estimated 50% of adults with ADHD, for example, also have an anxiety disorder, according to the Anxiety and Depression Association of America. Having ADHD along with another condition can severely interfere with daily functioning. Neurofeedback. Neurofeedback is a form of treatment that teaches you how to regulate your brain waves in an effort to enhance brain function and mental well-being. Brain activity is monitored through a machine called an electroencephalograph. Brain signals pass from one or more leads placed on your head to a computer, which translates the brain signals into a video or audio display. People with ADHD often have excessive slow-wave activity in frontal leads, indicating reduced frontal brain activity. Through neurofeedback, you can learn to do tasks that may enhance the function of the prefrontal cortex by suppressing slow-wave activity and increasing higher, that is, faster, frequencies. The technique is non-invasive and painless. Studies of neurofeedback's effectiveness have shown mixed results, however. Treatment typically requires 40 to 80 sessions, which can be time-consuming and expensive. Get restful sleep. People suffering from ADHD have an increased prevalence of sleep problems, insomnia, and chronic sleep deprivation, either trouble falling asleep, going to bed too late, night owl syndrome, and trouble waking up. 5 Many researchers have found that people with ADHD have an increased risk for sleep disorders including sleep apnea and a syndrome called delayed phases to sleep disorder. Sleep deprivation can have a significant impact on many areas of a person's life. Inadequate amounts of high-quality sleep can worsen symptoms of ADHD, worsening inattention, impulsivity, and procrastination. A key part of management in adults with ADHD is to look for and aggressively treat sleep disorders. Non-drug treatments include evidence-based cognitive behavioral therapy for insomnia, behavioral modifications, and improving sleep hygiene. Improve nutrition. The role of nutrition in the cause and treatment of ADHD is somewhat controversial. Research to support the many theories about dyes, additives, and sugar causing ADHD in children is unconvincing. That being said, many people with ADHD consume an unhealthy amount of high-carb and sugary foods, while not getting enough fluids. Much of this is due to poor planning. Adult ADHD patients find themselves missing meals and filling in with unhealthy snacks. There is also a tendency to self-medicate with caffeine, either to overcome underlying sleep disorders or enhance attention and focus. Sadly, too much caffeine causes anxiety, increases distractibility, and worsens insomnia. I tell patients to take an inventory of what they are eating. Try to gradually decrease sugar, caffeine, and carbohydrate intake. Consider carrying pre-packaged, portion-controlled, and protein-rich snacks such as natural peanut butter, natural cheese sticks, or nuts. Create structure. Do you often feel overwhelmed, anxious, exhausted, and disorganized? People with ADHD often struggle with a cluster of cognitive skills called executive functioning. Executive functioning includes behaviors such as time management, initiating tasks, organization, prioritizing, and follow-through. One way to minimize this burden is to create more structure and order. Having a schedule or a game plan helps patients feel calmer. This structure can be created at home and at the office. Two of the biggest constructs are calendars and task lists. These devices create an external form of accountability. Some patients with ADHD have difficulty initially implementing these things, but once they are in place, they are extremely helpful. Find an activity partner. An activity partner is having someone that you do a task with. Perhaps the best way to explain is to provide an example. One of my adult patients with ADHD, a designer, found a junior designer to be his activity partner. They discussed the goals for the day, checked in about progress for the week, and worked collaboratively on the project. His productivity greatly increased, but so did the creative output of the team. Plus, the work environment was a lot more enjoyable for everyone. This approach has been remarkably helpful for my patients. Remove food sensitivities. Food sensitivities or intolerances contribute to leaky gut and intestinal inflammation, which can negatively impact gut bacteria and the production of neurotransmitters essential for healthy brain function, worsening symptoms of ADHD like impulsivity and aggression. Testing can reveal individual sensitivities, but two common offenders are gluten and dairy. Partially digested dairy and wheat particles, called casomorphins and gliadorphins, are found in the urine. The presence of these particles is linked to difficulty paying attention, learning, and public relations, typical of autism spectrum disorders and ADHD. While not all people are sensitive to gluten and/or dairy, it's often helpful to omit these foods completely for at least 6 weeks. Spend more time outside. Studies show time spent in green space improves focus and attention, and decreases impulsivity in children with ADHD. The underlying mechanisms for these benefits aren't fully understood, but the benefits speak for themselves. Making a priority to spend time outside, whether in nature or your own backyard, benefits not only your physical health, but mental and cognitive function as well. Thanks for watching our video. Please don't forget to subscribe to our channel.